Larson. I'm a physician at Our Lady of Hope Clinic, and here today is our first live Facebook post, and thank you and welcome to our Facebook page. I'm here with Dr. Liz Larson. We're going to talk a little bit about what our clinic does and how it's different than other clinics. Myself, I'm a family physician. I've been practicing for a long time now, but I've been here with Our Lady of Hope Clinic for the last 10 years. Dr. Liz Larson, who just joined us in April, I'll let her introduce herself.
Hi, I'm Dr. Liz. I practice family medicine as well as obstetrics, which means I do prenatal care and deliver babies. I attended medical school here in Madison at the UW School of Medicine and Public Health, and then residency up in Appleton. After residency, I set up a solo, full-scope family physician practice in Columbus, Wisconsin, which is just 20 minutes north of here. And then I had that until the spring when I closed my practice to join you at Our Lady of Hope Clinic.
And welcome. Thank you for joining us. It's been great to have Dr. Larson here. We see a full scope of family practice patients. And our clinic's a little unique in that we actually have 3 different clinics in one. So we have our traditional family medicine practice, and we see uninsured folks that we see for free. We also have our member patients who we refer to as our direct primary care members who join our clinic as a subscription. And then we also have our NFP, natural family planning patients, who I consult with for various gynecological issues. We do a fair amount of fertility awareness, and I understand a lot of our viewers may not know what fertility awareness is. So basically it's observing the woman's cycle and her biological indicators to determine whether she's fertile or infertile. And through that information, then we are actually able to practice NaPro Technology. NaPro Technology being natural procreative technologies. And it's the science of studying a woman's fertility cycle, so to find out if there's irregularities or if there's problems that are preventing pregnancy or causing miscarriages. So our clinic does a fair amount of this work, and we are very grateful for being able to provide that to our patients.
Yeah, that is amazing. Even before I joined Our Lady of Hope Clinic, Dr. Mike, remember I would refer patients to you for not just fertility problems, but often for other menstrual kind of problems. For example, premenstrual syndrome or hemorrhage, excessive bleeding, and such like that. So you continue to provide that care as well.
Yeah.
And then, so if a woman wants to see you, is there something she should do to kind of establish that care?
Sure. So as part of our membership here at the clinic, we have instruction for natural family planning. So a woman can come here to our clinic to learn how to track her biological indicators, her temperature, checks mucus, various different types of biological indicators that will teach her how to record that information, to learn how to track it. And we actually have an instructor that will meet with her. They'll do what's called an introductory session, and they will kind of teach her how to track this information, and then meet with her every couple of weeks to see how that information is going. Now, when she meets with the instructor the first time, that introductory session could be done as a group with other people who are learning the method. But when they meet in follow-up sessions and go over her own chart, then it's always done on a one-on-one basis. But that information then will allow her to know exactly how healthy her cycle is. And what that does for me as a physician then, when she brings that chart to her appointment with me, then I can see exactly what's going on with her cycle, and we can then plan out how to treat or how to evaluate the cycle.
Excellent. And I've seen a lot of positive response with that in the patients we've shared. Speaking of sharing patients, there's times when we will co-manage a pregnant woman, so to speak. Right. So I will see them for their usual prenatal care and such, and Dr. Mike will see them for the NaPro side of things.
Exactly. Yeah. So when even before joining the clinic, we had several patients that we had in common, And I would manage the progesterone support in pregnancy because we've done that evaluation. We knew that they had some difficulty in their cycle. And prior to pregnancy, we may have supplemented them with progesterone. And then during the pregnancy, we continue to manage that for them, even while they're seeing their obstetrician or gynecologist. So we've had that in common. Now, we've been able to add you to our practice, so now you're able to do that all in-house here. But you're still providing the obstetrics. How does that work here at Our Lady of Hope Clinic?
Yeah, so women will typically come in sometime during that first trimester, so sometime by 12 weeks of pregnancy. Someone would like to come in really early to kind of establish the pregnancy and establish care. Someone would kind of like to put it off a little bit, but I like to see a woman by that 12-week mark. And then we talk about kind of what the standard expectations for prenatal care are, go through her history quite a bit, and then some lab work and stuff we have to do. And then we see the schedule on the face of it is very similar to what other OB providers would probably look like. But what's really different about here at Our Lady of Hope Clinic is we really, we schedule, we give women time in their appointment. So it's not unusual for me to spend 20 minutes or more with a woman during a routine prenatal visit. And that really allows us to establish a relationship with her, really get to know what her desires are for the pregnancy and especially for the labor and the delivery, which is the kind of the grand finale that everybody thinks of when you think of pregnancy. And not only that, but kind of address like what their concerns are, their fears, and things like that. So we really do a good job of really personalizing the care for each woman during her pregnancy and for each pregnancy, because pregnancies are different from one baby to the next. So
very good. And when you talk about the grand finale, what is that like? What are the delivery options?
Yeah, so you know, the prenatal care, we actually have two sites we can see women at, here at the Madison Clinic, or we have a satellite clinic in Columbus, so they can be seen at either site. And for delivery, I'm currently delivering at Columbus Community Hospital, which is just 20 minutes on north of Madison here. And I really like Columbus. That's where I practiced before we joined you, and I've got to say they do a great job. And they have a lot of options for labor, and a lot of women's main concern is pain management. So, you know, kind of what people think of the typical things are like epidurals and IVs. We have great nurse anesthetists to place spinals and such. But we also offer a lot of things that really enable women to have more natural labors, and by doing so, we really reduce the C-section rate at our Columbus Hospital. And those things are like water birth, which are not offered here in Madison, to my knowledge, and nitrous oxygen, which is kind of a newer thing. It was an old thing, went away for a while, now it's come back, and so we see it popping up in hospitals, and so we've started offering that. So women have a lot of options. I think the staff do a great job providing great one-on-one personalized care there. So I think women are in for a good experience there.
Oh, great. And we are very happy that you've been able to join us here. And for patients who want to choose you as their obstetrician, how do they become a member here at the clinic?
Sure. So there's several different ways that a woman can join the clinic here. They can go through the website, the ourladyofhopeclinic.com. Yep. Or they can call and speak with one of the staff here and get enrolled. And once they're enrolled as a clinic, they can schedule their appointment and go from there.
Very good. So our clinic is unique. Like I mentioned, it's a membership-based clinic. So you don't often see that. We don't accept insurance. We don't bill insurance. But it's a monthly fee, kind of like a gym membership, where you pay your monthly fee and then you end up going as often as you need to see your physician. So one of the things that we do is once that membership is signed on and you're subscribed, then we basically will see you as often as you need to. So we appreciate the membership. It makes our mission to serve the uninsured, which is the other portion of what we do, possible. And so Thank you for tuning into our Facebook page. We welcome you to ask any questions. We'd be happy to answer those in future Facebook posts. If you'd like to get a hold of us, you can always reach us at our website at ourladyofhopeclinic.com. Thank you very much.
Thank you.